Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
This JCO podcast provides observations and commentary on the JCO article, Individual Patient Data Meta-Analysis of the Value of Microsatellite Instability as a Biomarker in Gastric Cancer by Pietrantonio et al. My name is Osama Rahma, and I am an Assistant Professor of Medicine at Harvard Medical School, Dana-Farber Cancer Institute in Boston, Massachusetts. My oncologic specialty is gastrointestinal cancer and cancer immunotherapy. Despite the advances in surgical approach and perioperative multimodalities in gastric cancer, the recurrence rate remains over 50%. While many patients benefit from perioperative chemotherapy, many others don't derive such benefits and experience toxic side effects. Accordingly, there is an unmet need to identify prognostic markers to guide chemotherapy decisions in the neoadjuvant and adjuvant settings. Microsatellite instability has been well established as a prognostic marker in colon cancer that correlates with better overall survival and potential lack of benefit from adjuvant chemotherapy in stage 2 disease. The question is whether microsatellite unstable gastric tumors have similar behavior. To answer this question, subgroup analyses of patients with MSI-high tumors were performed in both the MAGIC and the CLASSIC trials, which established perioperative ECF chemotherapy in non-Asian population and adjuvant capecitabine and oxaliplatin in Asia, respectively, as the standard of care in resectable gastric cancer. Although MSI tumors were found to be less likely to benefit from chemotherapy, the low incidence of MSI tumors in both trials of 8 to 10% made it very challenging to draw meaningful conclusions. In the article that accompanies this podcast, Pietrantonio et al. Performed individual patient-level data meta-analysis testing the prognostic significance of microsatellite instability in both the MAGIC and CLASSIC trials. In addition, the analysis included the ARTIST study, which tested adding radiation to adjuvant capecitabine and cisplatin in Asia, and the ITICA-US study, which tested adjuvant FOLFIRI, docetaxel, and cisplatin versus 5-fluorouracil and folinic acid in Europe in radically resected gastric cancer. The meta-analysis included 1,556 patients, 63% Asian and 37% Europeans. Patients were stratified using microsatellite instability status and based on whether they received multimodality therapy in all 4 trials or surgery only in the MAGIC and CLASSIC trials. 7.8% of patients had MSI-high tumors and 70.8% received multimodality treatment. Consistent with prior reports of individual trials, patients with MSI-high tumors had better outcomes compared to MSI-low or MSS tumors. Specifically, the 5-year disease-free survival rate was 71.8% versus 52.3%, and 5-year overall survival was 77.5% versus 59.3%. MSI remained a significant independent prognostic factor for improved disease-free survival and overall survival in a multivariate analysis in addition to Asian ethnicity, low TNM staging, and receiving multimodality therapy. In addition, MSI was noted to be more prevalent in the Asian population and was a better prognostic factor in Asians compared to Europeans. Importantly, MSI-high tumors did not benefit from perioperative chemotherapy, with 5-year disease-free and overall survival of 70 and 75%, respectively for those who received chemotherapy compared to 77 and 83% for MSI-high patients who did not receive chemotherapy. In contrast, patients with MSI-low or MSS experienced benefit from perioperative chemotherapy compared to surgery alone. Finally, MSI status did not affect post-recurrence survival. However, this was limited by the small number of MSI-high patients who experienced disease recurrence. This study has several limitations, including its retrospective nature, the relatively small number of patients with MSI-high tumors of 121, and the heterogeneity of administered treatment in the 4 trials, including different regimens of neoadjuvant and adjuvant chemotherapy with or without radiation. In addition, D1 surgery was performed in Europe, while D2 surgery was performed in Asia. In summary, I think this study supports the adoption of microsatellite testing as a routine biomarker in patients with operable gastric cancer. The result of microsatellite testing should be discussed in a multidisciplinary fashion, since perioperative chemotherapy may result in more harm than benefit in MSI-high tumors. This study, among others, highlights the unique behavior of microsatellite unstable tumors, which is driven by their unique immune profile, including increased T-cell infiltration and activation due to higher mutational load and neoantigens compared to microsatellite stable tumors. PD-1 inhibitors are effective in more than 50% of MSI tumors in the advanced setting and in 15 to 25% of gastric tumors with positive PD-L1 expression. Accordingly, future clinical trials should stratify gastric cancer patients based on their microsatellite status and PD-L1 expression while incorporating immunotherapy in the early disease setting. This concludes this JCO podcast. Thank you for listening.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement. For more original research, editorials, and review articles, please visit us online at jco.org. This production is copyrighted to the American Society of Clinical Oncology. Thank you for listening.